Our target for tuberculosis is to make treatment much easier for the patients who have it. Currently, the treatment of tuberculosis is 6 months, and previously it was about 18 months. Through research from this center, we have managed to bring the treatment to about 6 months. And we continue to search for more short treatment regimens for tuberculosis, either drug-sensitive tuberculosis or drug-resistant TB tuberculosis. Our target is to make the patient more comfortable in being compliant or adherent to treatment so that we get cure for TB.
And again, in the cough sense data I mentioned earlier for TB diagnosis, again, you'd install an app on a Samsung phone. A patient would walk into a doctor's clinic, the patient would cough and the doctor would be able to tell whether that is TB. So, you know, some of the target product profiles by the WHO for CHIP diagnostics is they must be able to find 90% of the cases, be able to distinguish the people with disease and no disease, and be easily accessible and affordable. And we are at the forefront of working on things that create all those opportunities. We also have some work we are doing in pediatrics, and this is a novel diagnostic work. And we are looking at two very innovative diagnostics. So one is you take a very small blood sample from a child. Just as a way of background, children tend to have very low TB levels in their body. We call it postbacillary disease. So it's very difficult to prove that a small child has TB. So if there was a way you could just get a small blood sample from a child and be able to test them and confirm they have TB, that would be groundbreaking.
Another novel project that we are doing is checking on TB transmission, where we use a novel equipment called the cough aerosol sampling system. So in this system, a patient coughs into a vacuum space that has culture plates, and then through the aerosolization that the patient gets, it's able to be captured in these plates, and we are able to grow these plates in a culture lab. And our thoughts is that through this CAS machine, we'll be able to check among the community who are people who are able to spread the disease more than others. We are calling it a principle of super spreaders.